Good day everyone, I am Lloyd and today we will talk about some of the gastrointestinal disorder. Without a further ado, let's start. Gastrointestinal diseases refer to diseases involving the gastrointestinal tract, namely the esophagus, stomach, small intestine, large intestine and rectum, and the accessory organs of digestion, the liver, gallbladder, and pancreas. One of the disorder is hemorrhoids. It is also called piles, are swollen veins in your anus and lower rectum, similar to varicose veins. The signs and symptoms are itching or irritation in anal region, pain or discomfort, swelling around the anus, bleeding, noticing bright red blood discharge. Let's now proceed to some of the possible nursing diagnosis. Impaired tissue integrity may be related to 1. Hemorrhoidal surgery and procedures. 2. Alteration in activity. 3. Changes in mobility. 4. Aging process. 5. Loss of elasticity of the skin, possibly evidenced by 1. Disruption of skin tissue from incision sites. 2. Destruction of skin layer. 3. Internal prolapse hemorrhoids. 4. Pain. 5. Swelling. 6. Drainage. For the treatment, eat high-fiber foods. Eat more fruits, vegetables and whole grains. Use topical treatments. Apply an over-the-counter hemorrhoid cream such as hydrocortisone. Soak regularly in a warm bath. Take oral pain reliever, Tylenol, Motrin. So the next disease is ulcerative colitis. It is a long-term condition where the colon and rectum became inflamed. Small ulcers can develop on the colon's lining and can bleed and produce pus. Upon assessment to the patient ask if there's any pain, if there's a rectal bleeding, often experiencing diarrhea with blood or pus, having abdominal pain, malaise, weight loss and fever. For confirmatory test, a doctor can request a sigmoidoscopy, using a sigmoidoscope, a thin, flexible tube containing camera inserted to rectum. A diagnosis of ulcerative colitis by examining the level and extent of bowel inflammation. For the nursing diagnosis, here are some of it. 1. Diarrhea. 2. Risk for deficient fluid volume. 3. Anxiety. 4. Acute pain. 5. Ineffective coping. 6. Imbalanced nutrition, less than body requirements. 7. Deficient knowledge.
For treatment options, there is no cure for ulcerative colitis. There are widely effective treatments, usually involving either drug therapy or surgery. The last disease will be anal fistula. It's a small tunnel that develops between the end of bowel and skin near the anus. They're usually a result of infection near the anus causing a collection of pus in the tissue. Upon assessment, patient may report of skin irritation around the anus, throbbing pain that may be worse when you sit down, poo or cough, smelly discharge near the anus, passing pus or blood when poo, swelling and redness around the anus. For the possible nursing diagnosis based on assessment data are 1. Fluid volume deficit. 2. Impaired skin integrity. 3. Risk for infection. For the confirmatory test includes endoscopic ultrasound, which uses high-frequency sound waves, can identify the fistula. Another is fistulography, is an X-ray of the fistula that uses an injected contrast to identify the anal fistula tunnel. For the treatment, fibrin glue is currently the only non-surgical option for anal fistulas. It involves the surgeon injecting a glue into the fistula while you're under a general anesthetic. So that's all for today. This is Nurse Lloyd. See you on the next video.